Thank you. I'd like to welcome participants to today's telephonic press briefing. We're very pleased to be joined by State Department Coordinator for Global COVID-19 Response, Gail E. Smith, and USAID COVID-19 Task Force Executive Director, Jeremy Knindike. Today's officials will discuss the United States' commitment to global vaccine distribution and the milestone of the U.S. donating 200 million vaccine doses. Okay, we'll go to a pre-submitted question from Justabamungu Ange de la Victoire at topafricanews.com in Rwanda, who asks, Ethiopia is currently experiencing conflict. Do you have confidence that the Ethiopian population in conflict zones will be able to get vaccines? What do you say about similar situations around the African continent?
Yeah, I'll take that question, and thanks. It's a really good question. We have shared a substantial number of vaccines with Ethiopia that also has other sources. They've obviously got a big population. It is certainly our hope that those vaccines will be made available equitably to everyone who needs them. But your question points to an obvious challenge on that front. That is, where there is conflict, how do we approach it? What do we do? What's our confidence level? Look, where there's conflict, there's a challenge. Our effort is overwhelmingly to make sure, or whether there are political tensions, that these vaccines are shared on the basis of national vaccination programs, which countries share with COVAX in advance, and that they're based on, just as our global sharing is, the epidemiology, right? They're not based on politics. They're not based on any other thing. All of that said, it's one of the challenges we face and that we and other international partners are working on, not just in Africa, but in various parts of the world where we have active conflict, and therefore there is some risk that vaccination coverage won't be as high as it needs to be. So that's our focus, and it's a really good question.
I would just add, the USAID and the U.S. government and many international health partners have worked in conflict zones for many, many years and run vaccination programs in conflict zones all over the world. It's not a coincidence, for example, that we still have active polio eradication programs in places like northern Nigeria and other conflict zones. So I think what we know from those kind of experiences that this is something that can be done. It's hard to do this work in conflict zones, but it's also possible to do it. But it does depend in part on access, and so it will be important in Ethiopia and anywhere else where there is conflict underway that warring parties allow access for vaccination teams to carry these sort of activities forward. It's really going to depend on that.
Okay, our next question is from Alex.